Hello, Health Doctors community. My name is Dr. Austin. It is so nice to meet you. If we haven't met already, I'm sure I'll be seeing you in the office very soon. I'm so excited for you and your family and all the awesome changes you're about to experience in your lives once we get the nervous system in a place of healing, in a state of balance. Truly anything is possible, and we experience miracles here every single day. Today, I want to take the time to give you guys some more clarity, confidence, and a deep understanding of what's really going on in your kiddo's nervous system, why so many children today are struggling in ways past generations never did, and what to expect as we work together through your child's care plan, whether your child's experiencing sleep challenges, GI issues, sensory overload, anxiety, delayed milestones, chronic illness, whatever the label may be. We're not super big fans of labels here because in our experience a lot of them go away, just as an aside. Or if you're just simply looking to support you or your family naturally and proactively, this blueprint is going to help you understand the why behind it all, and more importantly, the neurological roadmap to health, healing, and thriving for you and your family. One thing that we always do here at the Health Doctors is we like to celebrate the wins. We're always looking forward, looking to what's possible, looking to what you all want to create for your future. This image is so important because all of your nervous systems, your bodies have truly amazing healing capabilities and potential. The sky is really the limit. Like I said earlier, we experience miracles here every single day. So at the Health Doctors, our team meets every day to talk about patients, celebrate the wins. We have a huge whiteboard in the back office that accumulates patient wins throughout the day, every single day. It's so amazing. We want to celebrate those wins with you all as well. So to start off the presentation, we're going to celebrate a few wins here. Over on the left, Jeremiah came to us with emotional dysregulation, impulsivity issues. However, after receiving care at the Health Doctors, calming his nervous system, giving him a chance to make sense of his environment around him, he began to experience huge changes in his overall happier, healthier quality of life. His mom said, "We finally got our Jeremiah back." So happy for them. We love having Jeremiah here. Jojo is another amazing kiddo. He came in after having massive regression in motor and speech milestones. He lost his ability to walk, talk, and was having a hard time with basic functions of life like sleeping, eating, pooping, like the only things the kid should be doing. However, Jojo is such a strong dude. His nervous system, his body did such an amazing job of healing once we got his brakes on. And he was given the chance to heal. He's now running around the office. Speech is getting better every day. He's calm, regulated, and doing all the things a kid his age should be doing. Here's a quick video of Jojo here. That's so cute watching little JoJo walk and talk around here. His mom said we finally got to watch JoJo walk by himself for the first time. That is awesome. Huge win, huge miracle here. Lastly, we have Rory here. Rory's mom was an ER doc. She brought her daughter in when she was experiencing emotional dysregulation and massive sensory overload issues. She would come in wearing earmuffs because external stimuli was just too much for her nervous system to handle at the time. After her body and her nervous system was given a chance to take a deep breath, focus on regulation, she stopped having panic attacks. She was able to sleep through the night. She was no longer overwhelmed by sensory stimuli, and she was able to live a happy, healthy life a kid her age should. So grateful for all these families here and all the miracles that they are experiencing, will continue to experience. So guys, our story is your story. Everyone here at the Health Doctors has their own unique miracles and stories that led us to the Health Doctors, and we see you guys, we hear you guys, we're here for you because we've all been in similar places or situations at some point in our lives as well. I can't say I know exactly what it feels like to go through what you're going through specifically, but I do know that we know how to lead you and your family on the road to health, the road to hope and healing. We have so many more amazing and miraculous stories from all of our patients here at the Health Docs, so we're so excited to be a part of your story and your family story as well. All right, guys, now getting into it, let's talk about the sequence of stressors we call the perfect storm. First off, an important concept to understand here is this: kids and adults don't grow out of stress. They don't grow out of old patterns. They grow into patterns. They grow into stress. I know this is contrary to the phrase that I know we've all heard before, oh, they'll grow out of XYZ issue, but that could not be further from the truth. The truth is symptoms and labels may change names over time, but the root cause of the issue is the same. The nervous system is stuck in that sympathetic gas pedal fight or flight mode. Unless we address the neurologic stress, the patterns simply repeat themselves. We're moving in one direction or the other, either deeper into subluxation or deeper into stuck stress, gas pedal on, or towards a more regulated parasympathetic dominant brake pedal first system. Early signs like colic, constipation, frequent illness aren't just random, they're the nervous system asking for help. As kids get older, those early signs often grow into sensory issues, anxiety, ADHD-like behaviors, or learning struggles. And in adulthood, the same unresolved stress patterns can look like burnout, chronic anxiety, digestive issues, immune challenges, XYZ. These challenges don't appear out of nowhere. They follow a clear, traceable pattern of a nervous system that is stuck in stress. That story, or the perfect storm as we call it, is a sequence of stressors that stack and build on a developing nervous system over months and years, and it can begin as far back as pregnancy or even preconception, much earlier than many parents realize. Today, pregnancy and preconception often come with far more stress and fear than joy, and many parents feel overwhelmed before a baby even arrives. Modern medicine is absolutely incredible at helping families conceive and bringing babies into the world. There's never any shame in how a child gets here. Every child is a miracle, no matter how they got here. Our goal is simply to understand the whole story, because mom and dad's nervous system becomes the blueprint for the baby's nervous system. When mom especially is under high stress, physical, chemical, or emotional, that stress can influence how the baby's nervous system develops. It doesn't mean anything was done wrong or that anyone made a mistake or there's any shame in any way. It's just part of the neurologic puzzle that can contribute into a perfect storm situation even before birth. By recognizing this early stress, we can better understand where your child's challenges may have started, and more importantly, how to get them onto a happier, healthier, more regulated path moving forward. Birth is often the first major stress event for a baby and for many moms as well. Even when everything goes seemingly well, an intense, fast, stuck, or medically assisted births like induction, epidurals, forceps, vacuums, or C-section can place strain on a baby's upper cervical spine, right where that vagus nerve lives, part of that brake pedal system, responsible for resting, digesting, and development of the child. When this system is stressed from the start, babies can slip into a sympathetic or that fight or flight mode far too early. In the first months of life, this often shows up as difficulty nursing, reflux, constipation, colic, poor sleep, or a baby who is either extremely tense or extremely floppy, low tone. These aren't personality traits, they're early signs that the nervous system is overwhelmed and asking for help. As toddlers, these early patterns can grow into signs like recurrent ear infections, delays in milestones, speech challenges, sensory seeking, difficulty with transitions, things often just mislabeled as like the terrible twos. By preschool, elementary years, these patterns become harder to ignore. Trouble with attention, emotional outbursts, hyperactivity, impulsivity, frequent illnesses, difficulty socializing. Parents describe these kids as like always on edge or wired but tired. And as teens, these stress patterns, the same stress patterns, can expand into anxiety, depression, fatigues, headaches, digestive issues, difficulty coping just with everyday stress. And in adulthood, the same underlying neurological stress can evolve into chronic anxiety, burnout, autoimmune challenges, and other chronic health issues. None of this is random. It's a predictable, traceable pattern, as you can see here, of a nervous system that is stuck in stress or stuck in that fight or flight mode. Neurologically, the story has three main phases. The first is sympathetic dominance, where the nervous system is locked in that fight-flight mode, and the parasympathetic, the calming vagus nerve, is suppressed, not able to do its job. This impacts everything from sleep, digestion, to immune, resilience, and emotional regulation. The second component of this is neurological disorganization. The communication between the brain and the body becomes inconsistent, confused, overloaded. This is when kids experience motor delays, clumsiness, sensory issues, impulsivity, emotional swings, difficulty coordinating movements and thoughts. The third stage is neurologic exhaustion. This is when the nervous system simply can't keep up anymore. Symptoms become more intense, more widespread. Our role as pediatric chiropractors is to help unwind this entire neurologic story so your child can begin to heal, develop, and thrive in the ways that they were designed to. Healing has a structure, and we don't guess. We don't take a wait-and-see approach. We follow a personalized care plan based on your child's history, stress levels, and neurological insight scan findings. The first phase is called the release phase. This is when we begin reducing accumulated tension and stress within the nervous system. Our goal is to quiet the fight or flight or that gas pedal response, improve vagal tone, and help shift the nervous system from that survival fight or flight mode into a more regulated healing state. During this phase, you may notice what we call neurologic soft signs. These are subtle cues that let us know the brakes are coming online, such as changes in digestion, eating habits, sleep patterns, and motor coordination. The whole goal of this phase is to break up the old gas pedal pattern and start creating new patterns, brakes first, regulation first, within the nervous system. You may also notice neurodetox period. In this first phase of care, detox can happen where we're making these big neurologic changes in the nervous system in cases when a patient's nervous system is very stuck in that gas pedal fight or flight mode, and so these changes can be temporarily uncomfortable for the nervous system. Just like anything new, there's sometimes an adjustment period. It's the body getting used to these new and healthy patterns. Similar to working out in the gym, you know it's healthy for your body, but within that first week or two, you're probably going to be sore after your workouts. This detox process does not take long at all. The quickest way to get through it is to stick with your care plan, keep getting adjusted, support the basic needs at home like proper rest, nutrition, hydration. This phase is typically shorter in duration but involves more frequency up front, anywhere from 3 times a week to daily intensive care depending on the patient and the degree of sympathetic dominance or how stuck their nervous system is. The second phase is called reorganize. Once the nervous system is in a more calm parasympathetic state, and more balanced, it can begin reconnecting and reorganizing pathways that were previously overwhelmed. This is where we start to see improvements in motor coordination, posture, balance, sensory integration, and emotional resilience. Children who are clumsy and may suddenly become more coordinated, speech may begin to develop more quickly. This is also the phase where developmental milestones can start to catch up because the nervous system finally has the bandwidth for neuroplasticity, the ability to grow, adapt, and change. This phase is all about making new patterns. Again, brakes first, a habit within the nervous system. Science tells us it takes at least 80 days to make a new pattern a habit. That's for anything in life. The nervous system is no different. This frequency of the second phase here is typically less frequent, but 2 to 3 times a week, for example, but it's a longer, again, 80 days at least, 3 to 4 months, and scanning along the way here so we can look at your nervous system and see these changes take hold. The final phase is called restore. This is where momentum takes over, goals start to be met. Parents describe this phase as the moment when their child becomes more themselves, more confident, more resilient, more communicative. This is when children truly begin to thrive. This phase isn't just about symptom relief, it's about long-term neurological resilience, healthy growth and development, setting them up for success for the rest of their lives. A key principle underlying all of this is something called the neurologic order of healing. The body heals in a specific, trackable sequence. This is why chasing symptoms never works, because you can't pick and choose where to start in the sequence. Healing begins with the autonomic nervous system. We have to address this component first. This is the foundation. This is the base of the pyramid on our chart here. This is the platform that everything else builds off of. When the system stabilizes, we see improvements in sleep, digestion, bowel movements, immune strength, calmness, and overall just regulation. Once the autonomic stabilize, the next level of healing involves the motor system. This is where improvements in posture, crawling, walking, coordination, balance, and sensory integration occur. All this motor information passes through a part of the brain called the cerebellum. It sits in the back part of the brain here, and all that information gets fed forward to activate higher level brain centers. Many of these higher level brain functions rely on motor stability, so this stage of motor development is crucial for everything else moving forward. Movement is life, as the saying goes. After that comes the gut and the immune system, which operate far more efficiently once the nervous system is not stuck in fight or flight. Parents often notice fewer illnesses, reduced inflammation, fewer allergies, better digestion, improved bowel habits, and overall better resilience. Finally, after all those foundational layers stabilize, we see changes in higher level cognitive and behavioral systems. This is the top of the pyramid. This is what many parents are seeking off the bat. This aspect includes improvements in speech, focus, attention span, emotional stability, social engagement, higher level executive functions, learning, and behavior. This phase, again, is often the phase we hope to see first, but neurologically it comes last. We have to address all the foundations leading up to this point before we can start to see these higher level cognitive changes. When we see signs of the other layers healing and improving, we know we're on the right path to making meaningful changes within the nervous system and improving the overall health and development of our kiddos. As you move through this journey with your child, remember that healing is a process that unfolds layer by layer as the nervous system releases stress, recalibrates, and rebuilds strength. The most important first step is simply getting clarity, understanding exactly where your child's nervous system stands today. If you haven't already, the most powerful thing you can do is get you and your child scanned, have your nervous systems checked. Our neurologically focused scans give us a clear roadmap to help us develop a personalized care plan for you and your family, and move from surviving to truly thriving. We are all in for you and your family. We want to walk this journey with you. If there is anything more that we can do for you, or any questions that you or anyone else in your family have, or you know of anyone else that needs support within you or your family, please let us know. We're here to help in any and every way that we can. You all have a great day, and we will see you very soon. Very excited for you guys and all the things to come.